Today is about taking care of our health workers. It's about taking care of the capacity in the health system, and it's about improved health outcomes for Australia. The Australian government has now received 60 million masks for the national medical stockpile. 22 million have already been distributed. This is 6 million more than we had expected. It is 2 weeks earlier than anticipated. It's a very important step forward. In particular, we've also been able to secure 100 million additional masks for between now and the end of May. And we'll immediately distribute 11.5 million of those to our hospitals, our aged care workers, our general practices, our pharmacists, and our allied health workers and our pathologists. What this means is that we are able to protect our healthcare workers in what has been an intensely competitive global environment, and it also opens up the possibility of elective surgery, and in particular IVF, recommencing at an earlier date than had previously been thought possible. And that's an important part of our capacity and an important part of the road out for Australians from the management of coronavirus and the suppression we've been engaged in of that coronavirus. Significantly, we have also been able to secure an additional 3 million flu vaccination shots. In particular, Seqirus has played a critical role in that, Seqirus being the Australian vaccine arm of CSL, and that will mean we're going from 13.5 million flu vaccinations to 16.5 million, and we are expecting that not just every Australian who wants to be vaccinated will be vaccinated, but that this will help with additional supplies, additional resources and additional capacities for our GPs and our pharmacies. All of this is about keeping Australians safe and helping them not just with coronavirus, but in the case of flu, with their other health. And whilst flu vaccinations are not a defence against coronavirus, they're not a vaccination against coronavirus, they are an important mechanism for reducing the rate of flu in our community, for protecting individuals, protecting health workers, and it means that people will not have to contend with two different respiratory ailments at the same time potentially, which is very important for their general resilience. Before going into more detail on these two measures, I'd like to give a brief health update in relation to our containment and our capacity measures, the two arms of our fight as a country against coronavirus. In terms of containment, we know that our elements are control of the borders, and we're seeing from the quarantine hotels the fact that the decision to have people in quarantine has been an extremely important measure in protecting both them and the general population. With regards to testing, we've now reached over 411,000 tests across Australia. And with regards to contact tracing, we continue to do excellent work around the country. And I want to thank our public health authorities across the states and territories for their work, which is helping to save lives and protect lives. And then in terms of social isolation, these continue to be our strongest weapons against the coronavirus. Social isolation, although it's difficult, although it's challenging, is extremely important in the fight against coronavirus. It's helping to bring down the rate of transmission. With regards to that, we now have 6,586 cases in Australia and sadly 69 lives lost. Very significantly though, our rates of hospitalisation, those in ICUs and those on ventilators, have all fallen. We now have 184 people in hospital with coronavirus, 51 in ICUs and 33 on ventilation, some of the lowest figures we've seen now for many weeks. In particular, we have had a rate of increase of less than 1% a day for 7 days straight now. I just want to repeat that. The rate of increase in new cases has been below 1% for 7 consecutive days now, and that's an important national achievement. What it means is we now have a sustained and genuine flattening of the curve. There's more work to be done. 53 cases in the last 24 hours, admittedly some of them within the quarantine hotel, says we have to maintain what we are doing, but what we are doing is working. As we go forward in terms of our capacity with regards to primary care, where we are here, what we've seen is that there are 4 million telehealth consultations that have now been completed. In aged care, we are responding immediately to any cases and any threats that emerge. And in Tasmania, where there was a threat that 3 aged care residences might have had cases, 491 residents and staff have been tested and 1 case has been found. And so whilst that 1 case is always of deep concern, that is a far, far better result than any of us had hoped might have been the case. In terms of our hospitalators, our ventilator capacity is significant, and as we see, there are only 33 people on ventilators. That still is 33 people on ventilators, and a significant amount, but dramatically less than anybody had been predicting or warning at this stage. But a critical path on the road out is the role of PPE, or personal protective equipment. There's been an intensely competitive global environment. Supply had dropped significantly. Demand had increased significantly, and through that Australia has been able to maintain an air bridge. We have now received 60 million masks into the national stockpile. We have already distributed 22 million masks from that. Perhaps most importantly, we've secured an extra 100 million masks over the next 6 weeks, and that means that we can now allocate an additional 11.5 million masks. That includes 7 million to our hospitals. It includes 2.8 million to primary care, with 1.5 million for our magnificent GPs, 500,000 for our pharmacists and 500,000 for our allied health workers, 160,000 for our respiratory clinics and 75,000 for Indigenous Australian healthcare workers. All of this means that we are protecting our doctors, our nurses, our pharmacists, our allied healthcare workers, our amazing general health staff. And I want to particularly thank our frontline doctors and nurses for their work, and our pharmacists and our allied health workers and our pathologists. As well as that, what this means is that a secure supply opens up the possibility for elective surgery to be progressively and cautiously recommenced, and for IVF to recommence. That will be considered by the medical expert panel and considered by the National Cabinet over the course of the coming week. Along with the flu vaccinations, the masks mean that we have additional capacity. The masks and the flu vaccinations are about protecting our healthcare workers, protecting Australians.
How soon can we see a return to elective surgery and IVF treatments?
So that will be considered this week, but what these additional masks do is to provide the supply, the capacity and the confidence for our hospitals. And so I am hopeful that during the course of this week, the medical expert panel and the National Cabinet will be in a position to make decisions and to give guidance for the future. In particular, I know that the Prime Minister and myself have been very focused on IVF as an important and indispensable treatment. So we're hopeful that over the course of this week, there will be some positive news. And today is about building that capacity and laying the foundations for the road out.
What would be the turnaround for that meeting? When do you think we can actually see?
National Cabinet is meeting on Tuesday. And so I'm hopeful that whether it's Tuesday or whether it's the subsequent meeting on the Thursday, that they'll be in a position to indicate that the states have confidence. The elective surgery decision was made on 2 grounds. One was PPE, or personal protective equipment, of which masks were critical. The second was the concern that if the coronavirus had grown dramatically, our hospitals would have been under intense pressure. At this point, Australians have done magnificently, and we are not facing a threat to our hospitals. Now it's about securing the masks and the PPE, and today is an important part of that, and laying the foundation for this week and the road out. Okay, Elias?
The Foreign Minister thinks there should be an independent global review into the coronavirus and its response. Is that something, and the response, sorry, is that something you support?
I agree with the Foreign Minister, absolutely. What we've seen is Australia has been able to have, by global standards, just a profoundly important and successful human outcome. But we've done that by following the course that our medical experts here in Australia set out. We do know there was very considerable criticism when we imposed on the 1st of February the China ban from some of the officials in the WHO in Geneva. The regional body has done well in terms of polio, measles, malaria, but what we saw from some officials in Geneva we think was a response which didn't help the world. We've done well because we made our own decisions as a country.
Bit of discussion around golf, Minister. What's your take on the safety of it in the current climate?
Our goal as a national cabinet is to set baseline standards, and we've done that. All the states have adopted those. Some have gone further, so I won't comment on individual measures by individual states. All of them are doing a great job, and so my view is that collectively the states have worked with the Australian government and the Australian people, and they'll focus on their own individual measures over and above the baseline Australian measures.
Barnaby Joyce and others have said they won't download that tracking app because it doesn't trust the government with his information. Is that undermining what you're trying to achieve with that?
I think our very point here is that this is voluntary. It's an additional part of our contact tracing. So at the moment, if any of us are diagnosed, the public health officials trace back all of those whom we have been in contact with. What the app would do is simply add to that. It would make that tracing easier. It's voluntary. The data stays on your phone. It then only goes to the public health officials, so the government would never have access to it, and it's only used to enhance what we're already doing. But the critical thing is it's voluntary and there's no government access, but it's one element of a much broader process of borders, testing, tracing and isolation, and those elements together are what have helped deliver Australians really a world-leading outcome so far.
Do you think enough people will download it to make it worthwhile?
If two people download, we'll be in a stronger position. The more that do this, the better it is for everybody, but it's an individual choice. I'll certainly be doing it, and I would encourage as many others as possible to help safeguard health workers, to help safeguard their families, and to help safeguard themselves. But it is a voluntary app.
Do you trust China's handling of the COVID-19 pandemic and the information coming out of China in regards to deaths, the amount of people that are infected?
Well, I think the critical thing here is that everybody is doing their best. We do know that the figures have been updated, and that they've been updated is good. Professor Murphy has previously said that the figures in which we have most confidence are Australia's, because we have the rigour, we have the data, and we have the systems in place, which have led to Australia's own figures being identified by the London School of Hygiene and Tropical Medicine as the most accurate of 83 countries around the world. So we have confidence in our own figures. We know that other countries are doing their best, and that
China specifically?
As with everybody else, they're doing their best. I'll let others with more detailed information make comment on them.
Do you trust the information coming from China?
I have the highest trust, as Brendan Murphy, our Chief Medical Officer, has said, in Australia's own figures, and then other countries will have differing degrees of accuracy. Probably what I would do is refer everybody to the international study of the London School of Hygiene and Tropical Medicine, which ranked every country according to the perceived accuracy of their figures. So there has been an international study, and I think that's the baseline for judging how each individual country is going.
Is 16.5 million flu shots enough to service every Australian?
That will more than meet all conceivable demand. But if more is required, more will be provided. At the moment, we're expecting that will far outstrip demand. In other words, supply will exceed demand significantly, but that's something that we're very happy to do to make sure that everything is covered. Now, I might turn first to Tom Manier.
Hi, Minister. Just returning to the app for a second. The government has talked this week about 40% being the number that you want to get to, ideally more in terms of the number of people that sign up to it. When you're making decisions in coming weeks about easing restrictions and looking to sort of ease the measures that we have in place at the moment, what does it mean if we don't get to 40% or a level like that? Will that mean that it'll be a slower process? Or I know you're talking about this being one part of a broader strategy, but how important is that number to some of those restrictions actually being lifted?
It's our goal, but anything which adds to our tracing capability adds to our ability to protect those who might have been inadvertently infected. What this is about is protecting those who might have been inadvertently in contact, inadvertently infected. And any uptake increases our capacity to help with the contact tracing, which increases our capacity to save lives and protect lives, to protect our health workers and to limit the spread. Eric?
Thanks, Minister. Just on the World Health Organization issue, what kind of body could actually lead an independent inquiry into a global pandemic? Does one exist, or would a new body have to be set up if it is not the World Health Organization? And secondly, is there some sort of coordinated response here? Is this the Australian government freelancing, calling for a independent inquiry, or is there actually a group of countries now looking to establish such a measure?
I think naturally at the end of any major global event, there will be and should be reviews, and they can occur at national level, they can occur at international level, they can occur on many different fronts. And so as to the specific mechanism, I'll leave that for the Foreign Minister at a time in the future. Right now, we're focused on fighting this virus. We are doing well in Australia, but we still haven't won. We are winning, but we have not won yet. Therefore, we have to focus on our containment and our capacity. Today's about capacity. Going forwards, there'll be absolutely many different pathways to reviews of what all countries have done. Interestingly, before the virus outbreak, the WHO in 2018 identified Australia as being at the global forefront of preparedness for a pandemic. I think they got that right. I do think they got that right, as we can see in terms of our testing, our tracing, and our case numbers, and in particular our flattening, sustained flattening of the curve. So there's plenty of time in